if you're feeling a little groggy today because of you or your partner snoring, we're bringing you a little help this afternoon. Dr. John Stafford is an ENT, and he joins us to talk about sawing logs. How you doing, Doc?
Good. How are you?
I'm fantastic. Okay, so we're talking about sleep apnea. What is that?
So sleep apnea, and more specifically, we're talking about obstructive sleep apnea. That's when your breathing is disturbed at nighttime. So while you're asleep, your muscles relax just as they do all over your body, and your throat as well. And so as you fall asleep, your tongue and throat can become more lax, and this can cause a blockage in your airway. That causes you to have a hard time breathing, and you may gasp at nighttime or not even realize that you're struggling. Your bed partner may notice that, but that's a very common thing that we'll see.
Yeah, so if you're affected by this, can it cause any type of, or have any type of impact on your body?
Certainly. I mean, as you're asleep at night, if you're not able to breathe or get rid of your carbon dioxide, those levels can build up in your blood, and that puts a strain on your heart and lungs. It's been associated with increased cardiovascular disease as well as stroke. It's also been associated with workplace errors and traffic accidents because of the increased sleepiness.
Interesting, interesting. How is sleep apnea tested?
So we test it typically with a sleep study. This is typically done in a sleep lab where you're observed overnight time. And they monitor all these different parameters, monitoring how you breathe, how your heart is doing, and how your oxygen levels are. This can also be done in a different way with a home sleep study done in your own bed.
Yeah. What about CPAP? What is that?
Right. So the most common way that we treat sleep apnea is with lifestyle modifications such as weight loss and trying to avoid late night alcohol use or any sedating medications. But for those that are needing treatment for this, the mainstay is CPAP, and that is a mask that can be worn either on your nose, on your mouth, or on both. And this provides a positive pressure amount of air into your throat while you're asleep, and this allows those relaxed muscles to be held in place and keep your airway open.
Well, some people say, I can't sleep with that thing on. If you can't tolerate, what else is there for you?
It's a very common thing that people struggle with not really tolerating the CPAP. And so for those people, my biggest concern is always trying to find a way to get them to use the CPAP. So if you have nasal obstruction or other areas where maybe if you can't breathe through your nose, we can try to make your nose airway a little bit more open, and that can sometimes make CPAP more tolerable. But if you can't tolerate CPAP for other reasons, such as claustrophobia, then fortunately there is a new device on the market called the Inspire implant.
Yeah, and what is that?
And that's called it's called a hypoglossal nerve stimulator. So it's an implant where you place basically a device into the chest here that monitors your breathing, and then you have another electrode here on one of the nerves in your neck. And so when you're trying to breathe, it recognizes that you're trying to breathe, and it stimulates your tongue to move forward in your mouth. It's done at a level that you don't recognize while you're asleep, and it holds your airway open, similar to how the CPAP works.
Good enough. Dr. John Stafford, ENT out of Jasper, we appreciate your time this afternoon and talking with us. Thank you so much, okay?
Thank you.
All right.